Actually, Nanda Prakash sir was the reason why I'm sitting in front of you. Actually, it's my pleasure and privilege to be a part of this wonderful webinar organized by Sir and Madam Soumya. So let me directly go to my presentation. This is related to eHealth, patient, and internet. So I am basically associate professor in Government College of Nursing, Ernakulam, Kerala. Thank you. Next slide, ma'am. We'll start with a scenario. An unemployed man applied for Microsoft clean worker position. Actually, that was the post clean worker. And Human Resource Department called for an interview. Microsoft Human Resource Department called for an interview. Then he cleaned the floor in the front of the test. And because he could clean that floor in a nice way, at that moment, he got a remark, "You are appointed." Then they asked, "Give me your email address and I will send you form to fill." Next slide, ma'am. The man responded, "But I don't have a computer nor an email." By hearing this, the manager exclaimed, "Excuse me, if you don't have an email, it means that you are not existing. And who does not exist, he cannot get this job." So simply because he was not having that email, he couldn't join as a staff in Microsoft. The man left with no hope at all. Next slide, ma'am. He did not know what to do. Only 5 pounds pound was there with him. Then he decided to go to a supermarket and bought 10 kilograms of tomato. After this, he roamed the door to door and sold this tomato. And less than 1 hour, 2 hours, he could manage double that amount. Next. The man realized that he could earn by this way, by simply uh, doing like this, and he increased the money. In a short time, he bought a car, then a truck, then he owned the biggest food chain business in America. Then he started planning his family's future. He decided to get some insurance and he called an insurance agent. He came and he asked, "Give me your email ID so that I can complete these proceedings." Then again he replied, "I do not have an email." Next slide. Broker replied, "You do not have an email and yet have succeeded in creating an industry? Can you imagine if you had an email?" So without email, this much popular he became, this much money he could earn. But the broker asked, if he had email, then how it would be? The answer was simply, "Yes, I will be a sweeper in a microscope if I have an email, if I had an email." So this is one scenario. Last, I will quote one more scenario, then you will realize what is the significance of this scenario. And moral of the study, simple, or the story is internet, email, BPM, WhatsApp is not a solution for your problem. If you do not have Facebook account, internet, email, BPM, WhatsApp, and you work hard, you can become millionaire. Next slide. So now things are changed. Previously, as Nandakumar sir was telling, we were moving to library and getting books, learning. Now everything comes on a fingertip. Next slide. As you know, communication technology. How many apps are there? How many methods are there to communicate? So changed considerably last 10 years. Next. Now your travel. So today I am traveling. Yesterday evening, I got a message that your train timing is scheduled. Your flight timing will be like this, and I can, as sir was telling, you can book a ticket from Rajkot to New Delhi by simply sitting in Kerala or Mysore. Next.
Dr. Riaz, we can't hear you.
Yeah. With regard to food delivery, you can imagine if I want a dish right now, it will be delivered to my room within 15 minutes. So things have changed considerably. Next slide. Now, e-commerce, if you want to purchase something, if you want to sell something, everything is on your fingertip. Next. With regard to banking, for the past 3 years, I never visited any bank. By simply sitting in my home while I am traveling, I can do my banking. I can invest money. I can borrow money. I can get loan. I can purchase anything without even going to a bank. Next. Now, warfare, by simply using a computer, an army person who is sitting in India can do a lot of war activities. So without even simply going in person, using this robotic system, we can fight with our enemies. Next slide. Yeah, this is marvelous with respect to entertainment. Entertainment industry is an industry that flourished like anything for the past 5 to 10 years. So only because of this information and communication technology, ICT. Next. Now, how we are governed by, how our leaders are ruling us, what are the bureaucratic system, everything, our democratic system, everything is clearly help using this with the help of this information technology, they are using effectively. Next. So that means in each and every field, like agriculture. So if you want a product right now with a specific color of fruit, specific number of seeds, within 10 days or 15 days, 16 days or 100 days after I need a product, it can be achieved through this internet and information technology. Next slide. Now, if so, health is also very much related, or health is also depending upon internet and information technology. Every walk of human life is influenced by internet and information technology. So let us see how health field is influenced by this information technology. That is all about this e-health class. This class is all about how health is associated with the internet and information technology. Next. So this is the basic thing, medical informatics. Medical informatics is the core term under which all these aspects are interconnected. Medical instrumentation, medical robotics, bioinformatics, medical imaging, big data intelligence, health management, emotional, economical evaluation, hospital organization, pharmaceutical studies, e-health and governance. So medical informatics is the technology, is the term that we use to notice how internet and information technologies are associated with the healthcare field. And various sub aspects are involved in this medical informatics. Among that, e-health is an important wing where we are dealing about how our health is depending upon electronic media, or how this government is using, or how the management or the how healthcare system is using this electronic aspect in health. According to WHO, e-health is defined as use of information and communication technology to support health and health-related field. So not only health, and it is also involved in health-related field. For example, social security measures. So social security measures are very much involved in healthcare system. For example, 2 years back, no, not 2 years, 3 years back, actually, there was one incident that COVID was spreading like anything in our area. I was in charge of a particular area. There, I received 25 to 30 phone numbers every day. So I need to call each and everyone during the morning time, and I need to support their health aspects. That was my duty given to me. So when I received one call, I received one phone number, I called them. So on that particular day, three members were there in their home. One father, mother, and one son. This son was affected with schizophrenia, and he was on regular medication. Unfortunately, his mother got COVID, and his father need to support mother who was in the quarantine center. So this particular individual who was alone at home, who was schizophrenia, if he is not taking medications properly, his symptoms will aggravate. So that was the situation. I received this phone number. When I called him, I found that he was not picking up the phone initially, but when he took the phone, he was talking irrelevantly. Then I was confused. What is happening with that individual? I never had an experience like that. So what I did is I traced out that locality, and from that locality, one ward member I could find, and I asked this ward member, what is happening with that particular patient? Then he replied that he is affected with schizophrenia, and I don't know what is happening. Then I could send this number to our healthcare system coordinator. Then he traced out his electronically generated his data. Then we identified that he is on medication, and 1 month back he took medication. Now, most probably, he must have stopped his medication. As a result, his symptoms got aggravated. Suddenly, we could report this content into that local area, and with the help of healthcare facilities in that area, we could support him, we could provide medications, and as a result, we could make him to consume this medication. So this is in general, this is the exact thing what we can see in eHealth. With the help of his previous data, I can help him, I can support him, I can provide medical care based on his previous data. If all these data are already entered into the system, this is exactly a practical experience I had with this eHealth. Next slide, ma'am. So domains of eHealth, as I said, mHealth is the mobile health. Mobile apps are associated with this eHealth. Telemedicine facilities are there. Another patient was affected with this problem. He could, with the help of video calling, we can make an appointment with the doctor at that time, and he could prescribe medicines for him, and he can scan the content, and it can be sent to his local authority, and they can provide medicine. So telemedicine facilities these are the initial steps that was taken 2 years back. Now things have changed much effectively. So mHealth, mobile health apps are involved in this eHealth. Telemedicine facilities are available. Clinical information system. So clinical information system is nothing but here different clinical problems associated with the individuals are entered into the system, and same patients with the same problems can have same background based on that same information. They can provide better care. For example, this has happened very recently in Nipah containment zone. Right now, it is happening in our area. One patient was affected with fever, and this problem was entered into his clinical data. After some time, same problem, patients with the similar problems were again came to that hospital. Then the physician noticed that a particular area, people from a particular area have specific problem and specific symptoms, and they could identify it as Nipah infestations. So that is what is clinical information system. Then integrated network. So integrated network is nothing but different hospitals are in network. 2 days back, my mother is on regular hypoglycemic agent and antihypertensive medication, and recently she had some problem related to some confusion and all. Actually, she was not in our home at that time. She was with my sister's home. When they took her to that hospital, none of his medical data was there with them. They simply go to that hospital, and by giving that thumb impression, what they could trace all the data that is relevant to my mother, and based on that simple thumb impression, they could retrieve the data. So that networking is nowadays possible, and that is using for better care. Then, of course, big data. As sir was telling about the big data, all the clinical data what we are getting from patients are nowadays uploaded in the system. And from this pooled data, we can identify specific problem. For example, goiter problem in a particular area, some skin infections particular area, some cancer manifestations in particular area which is affected with this industries and all. And as we said, this Nipah cases, all this information can be pooled, and only because of the proper entry of this data into that pooled system we can retrieve, and we can very well do this epidemiological study. So that is the use of this big data. Next. Now, use of information and communication technology in healthcare. So as you know, it is very much useful for health and education. Health, as we discussed, and also health medical education also, it is very important. For example, nursing education, medical education, pharmacy education also, it can be used. Hospital management system, that is very important, and it is developing like anything. Because of the proper entry of these informations, we can very well control many of this one, we can predict many of these problems. Then health research, this big data or pooled data is very much useful for doing health research. The changes that we can see nowadays, when we compare present day with the past, the changes that is taken place in the last 10 years only because of the research that has taken place in our area. So health research is another important thing that we can incorporate with this information communication technology. Of course, health data management. If you manage the data, next 10 years, anything valuable will be, one is water, second will be data. So anything we can enter into this one, and that can be useful after 10 years. Maybe tremendous changes that we can expect only because of proper entry of this data. So health data management is another important use of information and communication technology in healthcare. Next. Now we have different benefits of eHealth. As it's clearly mentioned that more efficient hospital and health clinics can be established because of this health. As a benefit, we can say efficient hospital care can be, efficient clinics can be established. Improved patient monitoring is possible. If the data is properly entered in correct time, in correct sequence, in correct method, in correct software, it can be used for better patient monitoring. Then, of course, it is useful for more informed patients. So everything can be shared with the patients. Sir was telling about a particular patient who is admitted in the hospital, and even though he or she is feeling that he is okay, but his BP is not controlled. Only because of the increased BP, he is not getting discharged. If this information is shared with him, he will be more comfortable. Otherwise, what he will do, he will constantly complain the system, and even if the symptoms are reduced, they are not discharging only because of getting this money, and they are doing like that. That complaint can be there. So always remember to make the patients informed. Then encouraging healthier habits. So e-health can be definitely help the patients to continue with certain habits that is healthier for them. Easier decision making and for the healthcare staff. Decision making is an important step, that is with regard to healthcare system. And if every data is available in the fingertip, the physician or the concerned authority can take the decision at proper time. Then more accessible and equal healthcare. That is another important thing because of the entry of this facility. Even a patient who is in the remote area, better expert care from eHealth has got a tremendous opportunity for giving better care for patients across the country, and different remote area also they can receive better care. Next slide, ma'am. Now, e-health, how it is operated nowadays. So it is constantly changing and constant refinement is taking place. For the time, it is convenient and centralized healthcare system that is monitored and controlled by an agency, and it is Aadhaar based. So, as it is Aadhaar based, each individual has got that unique number. Based on that unique number, we can upload data as well as we can access data. That is why my mother, when she went to that hospital, even if there was no medical data with him, only because of the finger impression, they could retrieve all the data. Only because of this, it is Aadhaar records. So it is very unique and it can be used for different aspects. Then it is purely funded by the government. Both the central and state government is funded for this e-health program. Next. Now, e-health, as it is in government setup, it has got this 5 elements. It's a one citizen, one health record. Online appointments for any hospitals nowadays available. Any government hospital in Kerala can get this appointment through this e-health portal. Then integrated picture archive and communication system. So if a patient is getting one X-ray nowadays, and now if it is uploaded in that into the system, anywhere from the world, anywhere from anywhere from the state, they can retrieve the data so that the continuity of care can be maintained. Sir was telling about that. Then seamless OP clinics. So OP clinics, which all OP clinics are running, which all day, and which all physicians are available in that particular day, or everything can be retrieved from this system. Then high quality healthcare at the doorstep. So by incorporating community healthcare system, this care and healthcare facilities are nowadays available for. Now, what are the 10 E's of e-health? So this is very important. 10 E's of e-health. First one is efficiency. It will definitely improve efficiency as we provide better care based on a comprehensive data. Comprehensive pooled data is using, hence efficient healthcare facilities are available for the patient. Enhancing quality care. So definitely quality will improve when the data is complete. Comprehensive data also will enhance quality of care. Evidence-based care, based on the past history, everything is entered into this system. So based on the past history, based on the past experience of the patient, as well as the evidence what we can get from the research system, and incorporating telemedicine, we can provide better evidence-based care for patients. Then empowerment of consumers. As we discussed in the previous slides, when the patient as well as the patient's relatives are aware about what is happening with their condition, when they get admitted in a particular hospital, what were the problems associated with them, how the things are changing, what all investigations are underwent, and what are the results they are expecting. If the results are like this is plan A and this is plan B. And if it is going in plan A and plan is not going according to plan A and plan B, this is plan C. So everything is planned, everything is communicated to the consumers. If the consumers are aware about this plan, definitely they will be more empowered, they will be more cooperative with the system. Then, of course, encouragement, not only for the patient, but also for the healthcare facilities. The e-health are providing better engagement. For example, recent Nipah identification, only because of a particular doctor who was aware about these conditions, he could correlate these symptoms. That is, common symptoms are coming from a particular area, and that definitely helped him to diagnose that Nipah case. As a result, he was highly appreciated by our management as well as the government. And that type of encouragement is possible through this e-health. Then, of course, education. It will definitely improve education. Not only medical education or nursing education, general education system can be improved by incorporating e-health. Then enhance. Better care can be enhanced, then extend. Nowadays, each and every individuals who are living in each nook and corner of the country can receive better care, expert care based on this telemedicine. So telemedicine or e-health definitely can extend the care what they receive. Then ethics. Ethics, this is another important. So ethically, each and every individual in a country has the same right to receive better care. As a result of this electronically motivated system of health, each and every individual, without his not based on their color, caste, or creed, they are receiving better care. So the ethics can be protected based on this e-health. Then equity, it is available all over the country. Each and every individuals in different nook and corner of the country are receiving health based on this e-health. So these are the 10 E's of e-health. Next. Now we can see applications of e-health services. It is applicable for medical healthcare management. Then, of course, it is applicable for different aspects that already we discussed. That is uh, strategic health planning, medical education and training, patient care and support, then the preventive health services, electronic medical records that Sir was telling about this, telemedicine services. So these are some of the applications of e-health. We already discussed. Next. Now, what are the barriers for implementing e-health services? Even if this has got enough advantages, it has got some barriers to implement. Some of the barriers are lack of awareness regarding e-health. Even if our system, our government is providing support services and training for healthcare professionals, awareness from the part of stakeholders are very less. So lack of awareness is one of the barriers for implementing e-health. Lack of confidence in e-health solutions. Even training programs are arranged across the state, and in-depth training is given for doctors, nurses, other healthcare paraprofessionals. Everyone is receiving this training, but even now they are showing some sort of lack of confidence, lack of interoperability between e-health solutions. That is another thing. So it can be operated from different stakeholders, different situations. The healthcare team members who are situated in a medical college may be well aware of this facilities, and a person who is sitting in a PhD is affected. Another barrier, limited large-scale evidence for the cost effectiveness. The cost that we need to provide for establishing e-health services is very high. The tremendous investment is required for establishing e-health services across the state, but how much it is cost effective? That cost effectiveness is not that much evident nowadays. So that is what is limited large scale evidence for this cost effectiveness. The lack of legal clarity. Even now, our court system, our judiciary is demanding some papers as evidence. How much we can convert that paper-based evidence to electronically entered evidences? So that clarity is missing nowadays. The lack of legal health service transparency regarding use of utilization of data collected by such applications. How much it is transferable? Nowadays, some issues are going on, like Aadhaar data is leaked. Aadhaar data, what we are entered into our Aadhaar system, is taken by external agencies, private agencies. So that lack of transparency is another problem that we can term as a barrier. Inadequate or fragmented legal framework, including lack of reimbursement schemes. If a person is appearing for reimbursement, applying for a reimbursement, nowadays what we need is a hard-based, paper-based data. Then only they will get the reimbursement. How much we can use this e-health-based data or information for reimbursement? That is also not clear nowadays. It's another barrier. High startup cost. I already told you the amount that we need to invest for establishing e-health services, the infrastructure that we require for establishing e-health services is very high. The tremendous cost is another important barrier that is making this e-health little bit backstepper. Then regional differences in accessing ICT services. Regional differences are there. For example, in the state, some colleges which is situated in the better access, as it moves distant areas or remote area, the accessibility may have problem with regard to the stakeholders that can be termed as a barrier for implementing e-health services. Next. Now, public health informatics, another important area in this health services. It has got a branch of health informatics addressing health practices. What are the health practices? That is a branch of health informatics, which is dealing with health informatics. It is dealing with research as well as learning. It's an organized application of information, computer technology, computer science, and technology. So public health informatics is an organized application of information as well as computer technology. Next. So categories of public health informatics, we can say study and description of complex system, which includes models of disease transmission, how disease is transmitting, how communicable diseases are transmitting, how genetically transmitted disorders are getting for individuals. So these are the areas that is focusing. Then identification of contingencies to improve deficiencies and effectiveness. How effectively we can modify existing healthcare system. What are the deficiencies that is faced by the individual with regard to current healthcare system? Can be used for as a categories of public health informatics. Then system to achieve such improvements by implementation and maintenance process. Using this public information system, information we can use or we can refine the existing system. Next. Then organization of public health and informatics. Centers for Disease Control and Prevention, which is running everywhere in the country. Mainly it is situated in New Delhi, as well as it is available in different state headquarters and district headquarters. So that is another an important organization with regard to public health informatics. Then Public Health Surveillance and Information Program Office also for functioning. Under this Center for Disease Control and Prevention, there is a Public Health Surveillance and Information Program. They are collecting information from the periphery. They are uploading the data so that early identification or early detection of communicable diseases can be identified. Under that, National Electronic Disease Surveillance System is also working. So these are the three important organizations currently working in our country, that is Center for Disease Control and Prevention, under which Public Health Surveillance and Information Program Office and also National Electronic Disease Surveillance System. Next. Then there are certain principles for this public health information in informatics, that is great impact on health of public. The primary focus of this public health informatics is focusing on the health of the public. Then they are using extensive applications. Extensively, they are using new technology. They are using new information. They are using various advanced technology for improving public health. So another important principle is extensive application. Then focus on primary healthcare. As we know, health is a state where we need to focus on the preventive aspect. Once we can prevent this occurrence of a disease, that we can save a lot of money in that aspect. Once the disease happened, in order to treat, in order to rehabilitate that individual, we need to spend a lot. So primary prevention is the focus of public system. Then targeting vulnerable population. As we know, in our society, we have that the elderly as vulnerable population, children as vulnerable population, pregnant ladies as vulnerable population. So this public health informatics focusing on the targeting vulnerable population, they are moving these strategies. Next. Now, National Health Informatic Infrastructure, that is otherwise known as NHII. So it's a comprehensive knowledge-based network of interoperable systems, which is capable of providing information for sound decision about health and when and where needed. So National Health Informatic Infrastructure is the core comprehensive knowledge-based network that is operating all over the country. Next. It has got three domains, that is personal and consumer domain, community and public health domain, and clinical domain. In personal consumer domain, it consists of standard of message content, what all message needs to be incorporated, foundations for reminder, because based on the system or based on the information what they are gathered, they will send reminders. For example, after 10 days, you need to again go for checking your BP. Your blood sugar level was like this. After 15 days, you need to again. So that reminders will be sent from the system. Then electronic medical record system. All the medical records that is available for an individual will be electronically updated. Then hospitals and OPDs are connected in the system. Then consumer health information system is also this nowadays healthcare system is also involved as a consumer protection consumer protection bill is incorporated in the healthcare system. As a result, each individual who is receiving care from a hospital is considered as a consumer. So that system is incorporated in this national health information infrastructure. Then personal health records. Personal health records are incorporated. Then electronic patient provider communication. So a patient is getting electronic communications regarding their health status, regarding the possibility of spreading a disease during a rainy season. Everything will be electronically communicated for the client. Then support groups. Alcoholic Anonymous groups are available. Schizophrenia support groups are available. Then epilepsy support groups are available, autism support groups. So such support groups facilities are communicated to the individual as a personal level. They are receiving this information. Then authoritative information they are getting. So that is the first domain. Second one is community and public health domain. Next slide. Next slide, ma'am. No, before that. Before. One slide before.
Okay. Yeah, your voice was breaking up a little. Yeah, this is fine.
Yeah. That regarding the clinical domain, decision support education, how a person is taking, how the medical fraternity is taking a decision, then professional growth, consumer protection, confidentiality protection, authentication of users, auditing, and penalties for violations. So these are some of the domains that is included in this clinical. So under National Health Informatic Infrastructure, three domains are there: personal consumer, community and public health, and clinical domains. Next. No, public health care informatics benefits are there. It helps in monitoring and protection, monitoring the healthcare system, health system of a person, health of a system, how it is improving or deteriorating, and we can protect it. Initially, early identifications will definitely help to protect their health system. Rapid and early detection of disease conditions, improvement in patient safety is another important benefit of this public healthcare informatics. Then reducing medication error. It's clearly written. As sir was telling about in handwriting problems. If it is entered into a computer and typed one, there will not be any medication error, and properly it will be communicated not only for the healthcare system, healthcare individuals, as well as for the public they are getting. Then improving public healthcare, then counseling and policy making. So these are some of the benefits that we can use for, that we can term as benefit of public healthcare informatics. Next. Now, it has got some barriers for adoption. Why it is not using? As I told, it is high cost. Interdisciplinary collaboration is required because some of the disciplines may not be accepting this interdisciplinary collaboration. Then skill enhancement is required. As I told, training. Doctors, nurses, and other paraprofessionals are getting training, but social services system or social security measure, those who are associated with the social security measures are not that much aware about this e-health system. So as a result, they are not able to involve in this properly. So hence, then training materials are available, but it is costly, and it is nowadays available on electronic based materials are available. Hence, that problems are sorting out nowadays, and difficult to upload previous data. It may be started 10 years back. A patient may have data regarding their health 15 or 20 years back. So that data may miss. As a result, continuity of care can affect it. So it may take little more time to streamline this system. Next. Now, public healthcare informatics role of a nurse. As a nurse, what is our role? That is a clinical practice. Definitely, these informations will improve clinical practice. How a nurse is working with the client in a clinic, how better care can be provided, how the assessment, planning, implementation, and evaluations can be effectively improved using this public health system. So that is one nurse's role. Then, of course, administration. As an administrator, a nursing superintendent or nursing officers, those who are working in the upper level, need to incorporate this public health informatics to the grassroots level. Then only we can improve. So that administration is also very much involved in this one. Then education, nursing education. In nursing education, nowadays this topic is included as a syllabus topic only because new generation nurses or new nurses who are coming for the next decade need to well aware about these things. So that is nursing education is also very much involved in this one. Then research, new researches are going on, and these researches will definitely will improve the quality of care for the patient. Then patient educations can be improved, and of course clinical alert system. When a patient has some deviant finding or personal information which is deviant from deviant that is affecting the health, that can be get as a clinical alert system. That is another important area a nurse has to think about. Next. So this is regarding a story of a camel and a small camel and their mother camel. This small camel asked the mother camel, "Why we do have this hump?" Then the mother camel replied, "It is because we need to live in a desert where we may not get adequate water. In order to store water, we need to have this lump." Again, the baby camel asked, "Why we have these long legs?" Then the mother camel said, "In order to walk through the desert, we need to have long legs." Again, baby camel asked, "Why we do have a round foot?" Again, mother camel replied, "In order to walk through the sand in the desert, we need to have round legs." Then the baby camel asked, "These are for camels who are living in the desert. When I am living inside this zoo, why I should have these facilities?" Similarly, today we do have a lot of information. We do have a lot of knowledge regarding computer and computer application. If even if we have this application, if we have this knowledge, if you are not using for our healthcare system, if you are not using for our patient safety, if you are not using for our patient care, what is the use of this information? Sir was telling 10 years back, people were asking why nurses should have these computers. Now the answer is, with even if we have this knowledge regarding computer and internet, if we are not using for our patient care, what is the use of it? So the Babel Camel asks, then what we are doing with these facilities in a school? So nurses nowadays can be termed as within a circle. We are restricting ourselves without using the information, without using our knowledge. If we are using this one, definitely nursing will have a better future for tomorrow. Next. So in conclusion, information communication technology will improve quality of healthcare. It will reduce errors. It will support teamwork. It will integrate best practices, and better research practices can be incorporated for patient care. Thank you.